Welcome to News Laundry Chota Hafta. For the full episode, subscribe because it is behind the paywall and only subscribers get access to uncut, complete content. News Laundry Hafta is our weekly wrap of all that made the news, all that didn't, and all that should have and all that shouldn't have. We agree, we disagree, we critique, and occasionally we beat each other up. But it's all good fun. Subscribe.
This is a News Laundry podcast and you're listening to NL Hafta.
अंग्रेज अपना लगान और न्यूज लॉन्ड्री अपना हफ्ता कभी नहीं छोड़ते. Welcome to another episode of NL Hafta. We are recording this at 3 in the afternoon on the 29th of April on Thursday. After a while, we have a full panel here on Hafta. We have joining us from Delhi, and we're all recording this from home because other than to record Manisha's show Nuisance and Atul's Tippani, we are working from home. So joining us is Mehraj from his home. Hi, Mehraj.
Hello.
Raman Kirpal. Hi, Raman sir. How are you?
Hi.
Raman sir is in Uttarakhand or Delhi?
Delhi.
He's in Delhi. And Manisha, as you can hear, she's joining us from her home.
Unfortunately in Delhi. Would have preferred Uttarakhand.
You would have preferred Uttarakhand, but you recorded Nuisance after what, a 3-week break in the middle? So probably by the time this Hafta goes up, it will be around the time Nuisance will be going up. So after a long time, we have Nuisance. Joining us also is Anand from Patna. Hi, Anand.
Hello.
How are you? All well?
Yes, fine.
And joining us is Banjot. Banjot, those of our regular listeners, you have probably heard her before on our podcasts. She's been a journalist for over a decade. She's based out of Delhi. She's been reporting on health for 8 years now. She was down to earth, and before that she worked in Times of India in Patna for more than 5 years, and she started her career in 2012 with ANI. She graduated from IIMC Delhi, and I just found out in my conversation with her she's from Rewa, where I have some very memorable memories of my shooting over there. Health has remained her major focus, and besides, she's written stories on water and sanitation, rivers, agriculture, and waste management. And as part of her reportage, she's traveled to 2 dozen districts of India, largely in villages of MP, UP, Bihar, Rajasthan, Odisha, and Maharashtra. And the scores of people she's met during her trips has been her laboratory of journalism. So welcome, Banjot. How are you?
Thanks, Abhinandan. I'm good. Thank you.
Right now, you're in Delhi?
Yeah, I'm in Delhi.
Before we get into the headlines, I'm guessing your reporting for the last some time would probably be all about COVID.
Yeah, more than 1 year now.
The latest wave, what do you make of it? Is it something that will go down like in Maharashtra? Some people say it'll follow that same trajectory. It went through the roof and now Maharashtra is on the way down. Delhi is on its own trip.
So there are various models which suggest that cases may start declining by mid-May, but the pace of decline would be much slower as compared to what the pace of going up of cases was. So the cases may start declining, but the decline would be slow. So we may not realize actually that the cases have started declining. The pressure on the healthcare system of the national capital may also not decline soon. So it will take some time actually for us to feel that, the cases have started declining. Though statistically it may start happening by mid-May.
I see. So before we get on to our discussion on the panel, let's get the headlines from Manisha.
Yes. India's daily COVID figures hit a new high today with 3.79 lakh fresh infections and 3,645 deaths reported in the past 24 hours. In 1 week, India has added more than 22.5 lakh COVID cases, and the cumulative surge in deaths has gone up to 89%. Civic records have revealed that over 1,000 COVID deaths are missing, quote unquote, in Delhi's data of COVID-related deaths. The Delhi High Court has said that millions of vials of remdesivir used to treat coronavirus may have been exported by India, but its own citizens are suffering due to an acute shortage of the drug. The Delhi High Court has also urged residents not to hoard oxygen cylinders and medicines as the second wave of the coronavirus batters the Indian healthcare system. They've also said that the Delhi police, should not be confiscating oxygen and medicines because patients are trying to procure these in desperation. Madras High Court has blamed Election Commission for COVID surge in Tamil Nadu. The Supreme Court has directed that journalist Siddiq Kappan to be shifted from Mathura jail to a government hospital in Delhi for medical treatment. The government of Assam and Maharashtra on Monday said they were unlikely to begin vaccinating all adults from May 1st because of the unavailability of vaccines. After an initial hiccup of OTP delay and server crash, cowin.gov.in started taking registrations and 75 lakh vaccine registrations. There have been no glitches, says Cowin chief R.S. Sharma. Serum Institute of India's CEO Adar Poonawalla announced that its COVID-19 vaccine candidate, Covishield's price for states will be reduced from 400 rupees to 300 rupees with an immediate effect as a quote-unquote philanthropic gesture. The United States on Sunday announced that it would immediately send raw materials for vaccine production. There was a bit of a delay in this and a bit of a drama. India has turned down an offer of help from the United Nations for an integrated chain supply of coronavirus-related material. One doesn't know why. Nagpur bench of the Bombay High Court has ruled that WhatsApp group admins can't be held liable for objectionable content posted by a member unless it is proved there was common intention or pre-arranged plan between them. Centre has asked Twitter to take down around 100 tweets critical of COVID handling. Facebook had temporarily blocked posts containing hashtags calling on Indian Prime Minister Narendra Modi's resignation. There was a lot of complaint about this, and then these hashtags were reinstated. And there's been a statement through ANI by the Indian government and the Information Technology Ministry saying that they never directed Facebook to take down any hashtags. LG Anil Baijal is now the government in Delhi as Centre notifies the law giving him more power. FIR was filed against a man in Uttar Pradesh who sought Twitter help for oxygen for his grandfather. Uttar Pradesh Chief Minister Yogi Adityanath has asked officials to take action under the National Security Act and seize the property of individuals who spread rumors and propaganda on social media and try to spoil the atmosphere. India has slammed Australian newspaper for a report criticizing Modi for COVID crisis, saying it is baseless and malicious. Meanwhile, Le Monde today has a very strong op-ed on the Modi government and its mishandling of the COVID crisis. Around 3,000 COVID infected have gone missing from Bengaluru, says the minister. IIT Kharagpur teacher allegedly abused students for not standing up for national anthem, as evidenced in a viral video. According to the print, the students of preparatory class were on a group belonging to the scheduled caste, scheduled tribes community and persons with disabilities. And the teacher lashed out at these students. And later on, she made an excuse that she has coronavirus, because of which she lashed out.
Let's discuss the sudden international coverage of COVID and of Prime Minister Modi. So there have been a few searing pieces. One is in the French newspaper, Le Monde, it's called, right?
Le Monde.
Le Monde.
Le Monde. Then, of course, the Purane Papi usual suspects of New York Times and Washington Post, etc. And I haven't seen anyone, such editorials speaking about the head of state of a major country like this, unless they're talking about a particularly bad week of Erdogan. I mean, I no matter how critical the language used, the way they have completely ripped into him. Is this a newfound whipping boy? Is it justified? Why so much attention? Is it because of the numbers, sheer population? What explains this sudden pushback? And of course, we'll talk about our Desi media later, but let's start with this. Manisha, you want to go first? Then we can ask the rest of the panel.
Like you said, the usual suspects have been critical for a while now, right? Time, Economist, New York Times, Washington Post. I mean, I don't know, even Economist at least has done a bunch of editorials, which has been quite harsh. But of course, here the scale of it, and I think they're also reacting to what they're seeing on social media. For them, at least, even if they don't have correspondence here, BBC does. But, even like an Economist or New York Times or the Australian paper, they don't have correspondence here, but they are gauging a lot of what's happening in India through social media, where you're seeing SOS messages, by the minute. You're seeing images of, people pleading for oxygen, dying, or vehicles, being used as makeshift ICUs. So I think the scale of the tragedy here, and of course, the thing is that how India manages the pandemic will impact the rest of the world. This is not about just India, because, if one country bungles, it's going to impact the rest of the world. We've already exported the mutant, quote unquote, as Banjot said. So this is also something that impacts them, I guess. So maybe that's why the language is more harsh. But to me, it doesn't seem particularly harsh, actually. I think that it's been fairly critical. I mean, it's been consistently critical, and I guess this is the most critical it's been.
Yeah, I think coverage is mainly, like Manisha says, it's driven by the sheer scale of the horror. I mean, anybody who's seeing these pictures, these visuals of mass cremations and people dying on the road. When there's no other way to put it than to just say, and not only are the people dying, the government seems completely absent. People are using Twitter to help each other out. So that scale of the tragedy, I think, is what is driving this coverage. But like Manisha also said, I mean, this has been picking up for a bit, and this is just like because it's just come out burst. And then there are also the images of like while this was happening, there are images of the prime minister holding rallies. There are images of the Kumbh Mela. So all this, I mean, this kind of built up into this volcano which burst out.
Certain publications for say for last 5-6 years it has been the routine, and for some, of course, it has been event driven or some tragedy driven as the present misery. There is nothing surprising in it. In fact, the government of India has reacted to one of the pieces in Australian, and it was a reprint of an article in perhaps in a British paper. And the Indian High Commissioner, because Commonwealth countries have these High Commissioners rather than ambassadors, Indian High Commissioner has written back to the Australian. And last year, again an Australian paper and a Chinese the ambassador there had reacted to a piece in the Australian version of the Telegraph.
I think the coverage is for the obvious reasons. Here is a leader who loves big rallies, in the middle of, COVID. Here is a leader who justifies Kumbh Mela, but in the same breath, he criticizes the Muslim congregations. Okay. Then here is a prime minister who is in a hurry to steal the thunder, to be called as a world leader. He exports 66 million, vaccines, where now we don't even know from May 1st whether 18-year-old will get the first jab. So I think his attitude and his reaction to a big time tragedy at home is something that I think anybody will criticize him.
Let me tell you, Abhinandan, it was in the first week of February, I think, or maybe second week. 3 international publications. One I definitely recall, Al Jazeera. I am not able to recall the other 2. They came out, and this was almost, like 2 or 3 days apart. All the 3 publications came out with stories saying how India was able to beat the virus and what might have been the theory behind this. So all those 3 stories actually did not have answer to that question, but they, kind of threw few nuggets. So the whole narrative that even the international media was building by February first week, I would say, was that India was able to beat the virus. The experts don't know how. The experts quoted in those stories did say that maybe India was celebrating too early, but the larger narrative was that. Come to February second week, the cases start rising. It was February second week when the cases started rising. Then March, and now we have the entire international media, just reporting, employing everything, whatever they have at their disposal to report this, massive second wave.
I will tell you today, just before recording this, 3 of my friends whose folks have had vaccines have got COVID. It's not serious COVID, but have had COVID. They've just been diagnosed. So they were figuring out, kya karna hai? Should we keep oxygen on standby or whatnot? Okay. Now, if the number is 0.04%, I find it very strange that I know so many people. Ki bhai 0.04% ke aadhe logon ko main hi janta hu. So, and one more case in our building. And what I'm saying is these kind of people are not there in the data set. Because I live in a colony which is predominantly retirees. So this lady, she has a caretaker because she's too old to move around. So she's had a caretaker for the last 3-4 years. Her caretaker is from, I think, Jharkhand, if I'm not wrong. Her mother died. So she had to take leave. And because it's a close-knit community, they said, okay, she is going, who can take care of her, who will get food, shoot, all that stuff. Now, the block representative, which is my mother, spoke to that lady's, the caretaker, and she said, my mother, actually, she had a vaccine and she died. So they said, what, she should have COVID? He said, we don't know. So what happened? She said, she got the vaccine. There was a side effect. One day she was ill. She became okay 2-3 days later. Then she fell ill again. And after 10 days, she died. We said, did you get tested? Is because of COVID? Is because she says, no, she was old. We don't know. Basically, It's an uneducated person. Now that person is cremated. No call came to her. Has she gone down as a death, a COVID death? Has she gone down as a death as an outcome of the vaccine? Has she gone down as unrelated death? How many such? No one has called up my family and asked, are you guys alive or not after your vaccine? How the fuck do they even know? So, I mean, I'm not an anti-vaxxer, but I'm not going to say that, oh, because what I'm saying may create doubt, I will, swallow what the government is saying, hook, line, and sinker. I don't see the data. And if I know firsthand of dozens of cases, then I'd like to know how effective this vaccine is. Banjot, am I being a primitive beast?
Sorry, just before Banjot comes in, just one small nugget of information. So Akanksha, our reporter, who's been doing fantastic job going out and reporting on what's happening around. So she has been going to crematoriums because she was doing a story. She told me she knows at least 3 deaths which happened after they had taken both doses of vaccine. This is in Delhi, like she went to 3-4 crematoriums at most.
Okay, so before I go into the data part, I'll say something which may appear as cliche because you might have heard it in a number of places, but I have to say this because this is a thing of science. And I'm not telling this because government is telling you or somebody else, but this is a thing of science. And this is a cliche by now, but I have to say this. Vaccines do not prevent infection. What vaccines do is they prevent that if you are infected, if you get virus, if you get exposed to virus after being fully vaccinated, what vaccine will ensure is that you do not get a severe disease. You do not require hospitalization, or you just don't get a severe disease, you don't die. You may, or anybody who is fully vaccinated. So what is full vaccination? The full vaccination is after second dose, 15 more days. So 15 days after the second dose, that is when one is supposed to have been fully immunized. So even after being fully immunized, one can very well get the infection, but that infection in all likelihood would be mild and it will not push you to hospitals. Definitely, I believe not to death. Having said so, when I say that not a single death will happen even after full immunization, I would be wrong. Because remember, no vaccine has got 100% efficacy. From 80% to 70% to 90% to some even 60%, we have different range of efficacies for every vaccine. So that range or that efficacy data only means that this is the percentage. This was the percentage of people who did not, who did not acquire a severe disease or who did not die. So there may be death even after full doses, 2 full doses, but the possibility of that remains very, very rare because most of the vaccines have efficacy of say 70 to 90%. That is one. Now, two, Abhinandan, you talked about data. I, for one, as a journalist, believe that journalism is nothing but literature in hurry, right? And literature is all about showing mirror to the society. So, if mass cremations are taking place today, we have to show it. We can't hide it. And mental health is a crisis. I agree to it. I mean, there are no doubts about it. It is a big crisis. But addressing that crisis would mean that journalists should stop doing their jobs. Is that the way out? Or the way out it? And it was done in the first wave. I'm not saying this in vacuum. This was done in the first wave. Helplines for mental assistance were opened. Prominent mental health institutes of this country were made part of this, and helplines were opened. Why can't they open the helplines again, where whoever is feeling kind of anxious or whatever thought he or she is going through, which is too much for him to take, these helplines can be opened if you're really worried about mental health crisis. I mean, asking journalists not to do their jobs, will it solve? I mean, it's not nothing to be personal about it, but there, out of 4 people in my family, 3 are COVID positive. None of them is watching TV or reading newspapers because they have really no energy to do it. But the amount of anxiety that they have at this moment, and which also gets passed on to me, that has got nothing to do with the reportage.
Reporting from the crematoriums, from the crematorias and on cremations is actually telling us the gap in between what the Delhi government is telling us and what the reality can be. And look, I'm sure images of cremations will always be more striking than burials because there's a ground on fire basically. So perhaps that is why people don't remember, the drone shots from the US or from Italy, because these were graves. And that's not really, I mean, it's not as striking as, say, a picture of cremations, but this has been done throughout the world to show the scale of large-scale destruction and deaths the pandemic has caused. I mean, cremations are the place for reporting right now, and especially with this government, which is so cagey about data. I mean, to me, I find it so surprising what Banjot said at the beginning, that we don't even know about the Indian variant, how transmissible is it? I mean, for something as basic as that we should know, this would help us, right?
Right.
This is really a disingenuous argument. I mean, it's true. I mean, it would be wrong to say that people see these things and their mental health is not affected. Yes, so for some people, it might be the case. But as a journalist, you always make a decision that is this in such public interest that you can take that risk, that it might harm some people, like their mental health, but the public interest is so overriding that you still have to report it. And I don't know where these people have been like living all this while. This is what journalists have been doing since the beginning. Such pictures, such videos, they have changed history. The only thing, I mean, if you talk about the Vietnam War, for example, what do you remember? That naked girl running from the napalm attack. What do you remember? I mean, so many people died during the migrant crisis in Europe. What do you remember? That small kid lying on the beach face down. What do you remember from the Bengal famine? I mean, we didn't even know there was a Bengal famine until we grew up and started reading. And you still see those pictures, those tracking pictures, and you see, okay, this is what Churchill did, for example. You see that picture of that vulture hovering over that girl in Africa. This is what journalists have always been doing. This is, you are recording this. I mean, I have no clue what these people are going on about.
Yesterday, a reputed photojournalist, a photo editor, is very well known. His mother passed away because of COVID. There's a separate story. I mean, he went from one hospital to another. I won't go into that. But after the death, he hired one, it was in Greater Noida area. So he hired one, ambulance, and that ambulance, it cost him 20,000 rupees. The distance was about 12 to 15 kilometer. So he goes to the crematorium. He reaches that place at around 6:30, 6 o'clock. And then he's waiting for his turn. And he went to the electric crematorium. So now, after waiting for 4 hours, he was the last one apparently. So his turn came at around 11 o'clock. So the crematorium guy said,
where this debate has surfaced, if you stay away from social media, you will not come in contact with this kind of debates. So it is not a debate that is in regular public discussion. And let me take a very cynical view of it, that there is a crisis, but you don't stay with the crisis. What you do next? Like, say, politicians know what they will do, and journalists what they would do, bureaucrats what they would do. Now, politicians would, not because they want to do something good or great, but because now their political interests are tied to being seen as doing something in response to the crisis, they will do something. They would do something, even if it is effective or ineffective. They would do something in their constituency, or they would like to be seen doing something. So not because they're great or good, but that is how they see now their career tied with for say next 2-3 months. Now journalists, I don't believe that all of them are very much moved by some great public interest, but that someone was saying that that's their work profile. They would report something that is something in front of them.
A lot of people in this country don't realize how governance is happening. It is centralized to a level it has never been seen before. And I'm telling you, after Raman sir will also bear me out, he has also spoken to many senior bureaucrats. People who report to the PMO are overruling cabinet ministers, much to their embarrassment.
Right.
So a secretary or a joint secretary level person who reports directly to PMO can overrule a cabinet minister. No one is willing to say anything कि boss बताएगा जो करना है, हम तो कुछ करेंगे ही नहीं. So बैठो.
Secretary of the ministries, all the ministries, they come from the PMO. Okay, the minister himself cannot decide who the secretary will be. Even their own private secretaries, even they, I mean, some of them, they
so
also
it's,
come
I mean,
from
the decision making is centralized to a different level. So Why? So if he doesn't know, then no one is going to take any call on anything, because depending on how political fallout of that call, they'll be rewarded or punished. So no one wants to take a chance on anything.
No, I think it's pretty clear, because in December is when a TV media had also started playing up Modi as this world leader that other countries are looking up to, and who's going to lead the light and who's going to take us all out of the pandemic. So this vaccine methi thing again just seems to be something that was supposed to polish his image as
No,
this
Manisha,
world
just
leader.
about that particular point. I mean, a lot of this was, I mean, they made photo ops, they turned it into this huge charity and donation thing. A lot of this was contractual obligation for SII.
20 million of it was, but 36 million was commercial exports.
Yeah,
And
but
10 million
it
were
couldn't-
grants from government. It's still quite a lot.
Yeah.
No, actually, see, one point.
Go ahead.
See, I think there is a cost benefit analysis. If it's a more of a failure of foresight. They were too confident that they have overcome the worst phase of the pandemic. And Modi's foreign policy urge for international approval has been there, and he wanted to put all eggs in this basket. Yes, as Mehraj said, that India was just a guarantor of some contracts between private firms and foreign countries. Now, there is a clause, what in bureaucracy, I don't know, it's a French term, I don't know the exact pronunciation, it's called force majeure, means you can cancel all the obligations if the domestic demands are there, and you can say, sorry, we cannot do that. Because our own demands are there. That could have been put in hindsight, put in place a bit earlier.
All of you listening in, the Chota Hafta, do subscribe so you can listen to the entire Hafta. We will see you again next week with the Hafta. Till then, subscribe, pay to keep news free, because when the public pays, the public is served. When advertisers pay, advertisers are served. Thank you. Goodbye.
All the News Laundry podcasts are available on Stitcher, iTunes, and any other podcast platform.
Please subscribe to News Laundry. Help us keep news independent. To catch all our podcasts on news, pop culture, current affairs and sport, visit newslaundry.com. Follow us on Facebook, Twitter and Instagram, and subscribe to our YouTube channel. सुन लिया अफ्रीका मुफत खोरों? Not to brag or anything, but News Laundry Hafta features in the top 50 in the world on SoundCloud in the news and politics category for podcasts. So do subscribe and see what you're missing, because when the public pays, the public is served. When advertisers pay, advertisers are served. Subscribe, help keep news independent and free. All News Laundry podcasts are available on iTunes and Stitcher and any other podcast platform.